Namaste. Welcome to Pratimoksha's health and wellness show, Transform to Transcend. It is our hope that with this show, we not only bring yoga into our larger community, to our students, children, executives, homemakers, health-line workers, in fact, people engaged in all walks of life. But this is a show to address specific queries of problems that trouble you and affect your quality of life, be it your back or your neck. We hope that we can address each one as you put them forward to us. We truly believe that yoga can help transform you not just physically but also mentally. So welcome to your show. I am Maria. I am a wellness blogger for Pratimoksha and a lifelong student of yoga. I truly believe in yoga, and I hope that with these shows, you will also come around to our point of view. Now let me introduce Ms. Lalita Vishwanath, Yoga Acharya, Certified Manual Osteopath, Reiki Practitioner, Pranic Healer, and a yoga therapist with more than 20 years of healing experience. She and her team believe that yoga should be authentic, traditional, and connecting the mind, the body, and the spirit. That is when you achieve transformation. So it is my privilege to welcome Ms. Lalita Vishwanath to our show.
Thank you, Maria.
Welcome.
Namaste, everybody. A hearty welcome to Pratimoksha's Transform to Transcend.
Our show Transform to Transcend is divided into two segments. The first segment, Wellness UAE, addresses issues that are relevant to our community. The whole of February is devoted to cancer awareness, so we have chosen this particular topic, and we hope that Ms. Lalita can share her expertise with us for cancer survivors and also for the prevention of cancer. Cancer, as we all know, is an abnormal growth of cells, harmful cells. It is believed that 20% of our cancers is genetically linked. It is through hereditary factors, whereas 80% of our cancers are actually related to the way we live our lives, our environment in which we live, the pollutants that we face every day. So that is actually good news, because 80% of our cancers can actually be prevented through modifying our lifestyles, or at the very least it can be slowed down. The growth of these abnormal cells can be slowed down. Let's listen to Ms. Lalita on cancer and how yoga specifically can prevent cancer, and also for cancer survivors, how they can cope with their condition through yoga. So Ms. Lalita, can you please tell us how yoga is a palliative solution to cope with cancer?
Right. So today, yoga is a widely used term for exercises. But the practice of yoga goes way beyond asanas or exercises. It is all about integrating our various aspects of life into a day-to-day routine. For example, your sleep and wake up cycle, your food and diet routines, similarly your activities. Most of the cancer is seen when you're obese or when you're not following a disciplined lifestyle, and so on and so forth. So it's very necessary to integrate all the different aspects into our life to be able to prevent cancer or as a palliative care for cancer survivors, basically.
So Ms. Lalita, how do we integrate yoga with modern medicine? Because patients undergo treatment, it is quite a rigorous form of treatment, especially in modern medicine. So how do you integrate yoga with modern medicine into their routine, into the cancer patient's routine?
Right. So as I mentioned earlier, yoga is more of a preventive method because it involves various different lifestyle, and with this understanding, if somebody wants to incorporate yoga as a palliative care, it's easier for them to cope up with the modern medicine.
But is it possible for that yogic discipline to be incorporated into their healing routine, what the doctors are prescribing that they do, and you know, that the chemotherapies that they have to undergo? So is that possible?
It is. It depends on which stage of treatment that they are in. So let's say if they are going for immunotherapy or radiation, then it might be really exhausting for them to follow a yogic discipline like asanas or pranayama. So the best thing that they could do is some kind of a simple meditation technique which can be guided. Then the second thing is listening to creating some hobbies, inculcating some hobbies or recreation which they can put their mind and body at work. So it is a constructive but less demanding on the body. So this is again, as we call it, it's a way of life, and it's not about just the practice of exercises. So the point here is, when we talk about yoga, the exercise part of it comes very quickly to people's mind, whereas yoga is all about incorporating other disciplines as well.
So obviously, yoga can help in improving the mood and psychological distress that cancer survivors often face. Is that so?
To maintain a positive frame of mind when you are sick is easier said than done. So the important thing is to associate with positive, mindset people. Similarly, going out for a walk in the open air. These are all again lifestyle changes which we must adapt according to the safety also should be ensured. If you're going out, particularly in today's time, we need to keep ourselves safe and secure if you're going through a treatment. So having said that, breathing exercises help elevate the mood. So oxygenation, it helps the lungs optimize its efficiency, and when the yogic disciplines are focusing on breath work, it also calms the mind. So the yoga teacher or the yoga therapist will be able to guide you through the process very smoothly to sail through the difficult phase.
Can patients who have cancer, can they do all the asanas, or do you modify them for so that they can practice it safely and without too much of exhaustion, considering that they are undergoing treatment as well, or they have undergone treatment and then now they are kind of in the process of healing?
So there are different stages. It depends on which stage that the client is in or the patient is in. Suppose they are post-surgical, if a mammectomy or a lumpectomy is done, then they would have water retention in their armpits and things like that. So there the therapist will understand that, okay, this is the range of motion that they should be achieving, and these are the exercises. So there are specific exercises for specific treatments. Similarly, after the radiation, when you post radiation, they'll suffer from a lot of breathlessness and fluid collection in the chest area. So there the client might have to be taught how to breathe effectively, and other precautions. Other yogic disciplines are also the cleansing techniques and so on and so forth, but of course under the guidance of the doctor also. So the oncology department, there are many oncology departments who would love to integrate with the yoga and wellness program. Yes, so there are, in fact, there's a support group for cancer survivors which is under the wing of the oncology department, and the yoga is a palliative care unit for them. So this is how they work.
Thank you, Ms. Lalita, for sharing your expertise on this very vital subject that is affecting so many of our people. Unfortunately, we don't have time to address all the questions that we have in mind, but we do hope that these answers from Ms. Lalita have been informative for you, and we would like you to share our video with those whom you think this can help, and do come forward with comments and questions. We would really love to hear from you. So please subscribe and please share our videos. Please send in comments, suggestions, questions, anything, because remember, this is your show. Thank you so much.